Abena Oppong-Asare.
It's a pleasure to serve under your chairmanship, Mr. Graham Grady. Can I begin by thanking the member for Romsey and Southampton North and our committee for producing such an important report and securing this debate. Can I also welcome the committee's approach to looking at the effect of the pandemic on people with protected characteristics under the Equalities Act. It is clear that although the pandemic has affected everyone, those groups in society who have already faced structural barriers and discrimination have been hardest hit. It's for this reason, last year, I worked with an organisation in my local area to produce a report into the effect of the COVID pandemic on people in Erith and Thamesmead who fell into one or two or more protected characteristics. In April last year, I met with members and representatives from Inclusion London and Greenwich Association of Disabled People to discuss the local and regional impacts of COVID-19 on disabled people. And it's in this time I'd like to set out a few of our key findings related to disabled people in my constituency and steps I believe the government must now take. A number of organisations and individuals have raised concerns about measures in the Coronavirus Act relating to the Care Act, the Mental Act and the Children and Families Act. I'm pleased that the government has now listened and ended the provisions related to the Care Act, but I know there are still concerns about the risk to disabled people and young people due to the easements to the Children and Families Act. Research by Inclusion London has found that only 32% of disabled people to disabled children received all the SEND provision with the EHCP, with the rest either receiving some or none of their usual provision. As we move into the recovery stage of this crisis, I urge the government to look again at this and ensure that disabled people and young children are able to access the support they need for their education. Erith and Thamesmead constituents have raised a number of concerns about access to food for disabled people during the pandemic. For example, disabled people who usually rely on supermarket deliveries but who are not considered clinically extremely vulnerable struggle to access delivery slots. Food parcels provided by the government did not take into consideration accessibility needs such as mobility and available cooking appliances. And then there was limited supermarket delivery slots, which meant that people were not able to shop at cheaper supermarkets and therefore grocery outgoings increased for some people. And this is something the RNIB has also reported. I welcome the guidance from the Equality and Human Rights Commission to ensure that food retailers make reasonable adjustments to disabled people throughout the pandemic, but the government must do more to ensure that disabled people are properly supported in any future pandemic or emergency. Many constituents have also raised concerns about mobility and travel accessibility during the pandemic. Issues included being unable to access support on public transport due to social distancing, problems visiting locations such as supermarkets with carers due to one-person shopping rules, and difficulty hiring personal assistants during this pandemic. Finally, looking towards the future, disabled people have been disproportionately impacted by the effect on the pandemic on employment. According to Inclusion London, over 37% of disabled people have experienced financial difficulties or employment issues due to COVID-19, including problems with access to work scheme, discrimination in the workplace, and failure by employers to make reasonable adjustments. I just want to conclude by saying I fully support the committee's call for an independent inquiry into the case of profoundly adverse effects the pandemic has had on disabled people, including the stark disparity in the death rate among disabled people. And rightly, we should look into decisions and policies of the government and public authorities. As we begin to recover from the coronavirus, we need to see increased funding for health and care services tailored towards disabled people. I also strongly believe that legacy benefits should have been uplifted in line with the universal credit and neither should be cut later this year. I also want to see the government funding user-led organisations to level that recognises their essential role in ensuring that all public and private services are accessible to disabled people. A national strategy for disabled people is needed more now than ever and must contain a long-term plan for employment and accessibility at work. As we begin our social and economic recovery, government must ensure that disabled people are never again left behind. Sadly, they have too often have been over the last year. Thank you, Chair.